So let's start our video talking about pneumomediastinum, how to spot pneumomediastinum on chest X-ray. And after spotting pneumomediastinum on chest X-ray, what is the most likely diagnosis? The most likely diagnosis of pneumomediastinum on chest X-ray is Boerhaave syndrome. What is Boerhaave syndrome? It's esophageal rupture caused by forceful vomiting. How to diagnose Boerhaave syndrome? Boerhaave syndrome is diagnosed by exclusion of other causes of esophageal rupture, which is traumatic, iatrogenic, and neoplastic. So let's start. How to spot pneumomediastinum on chest X-ray. Chest X-ray signs of pneumomediastinum include, can you see these vertical streaky lucencies parallel to the superior mediastinum? Vertical streaky lucencies parallel to the pneumomediastinum, which represent air within the superior mediastinum and within the soft tissue. Within the soft tissue of the superior mediastinum. Okay. To imagine that, I will show you a CT scan here. Okay, can you see the CT scan? Can you see the air within the soft tissue of the neck? Okay, so these vertical streaky lucencies here represent air within the soft tissue of the neck. Okay, when you go downwards, you can see another sign, which is a thin white line parallel to the mediastinum, like this. A thin white line parallel to the mediastinum, which represents that the mediastinal pleura is separated. The mediastinal pleura is separated by air. The mediastinal pleura is separated by air within the mediastinum. Okay, and also to imagine this, I will try to show you another CT. Okay, can you see this? Here, the mediastinal pleura is separated from the mediastinum by air. Okay. Also here, the mediastinal pleura is separated from the mediastinum by air. Okay. The last sign on chest X-ray to spot pneumomediastinum is the continuous diaphragm sign. Okay, so you'll see, if you go with the diaphragm like this, it will end here in this part. It may be seen here, but it will end here. So the continuous diaphragm sign like this is another sign that there is air here between the diaphragm and the mediastinum. Okay. Okay. So the imaging features is in keeping with pneumomediastinum. okay? Pneumomediastinum with soft tissue emphysema. Potential causes for this are, or the most likely cause for this is a ruptured esophagus. So, a ruptured esophagus is more likely to cause pneumomediastinum than ruptured trachea, bronchi, alveoli. And the iatrogenic, and the Boerhaave syndrome is the most likely cause of esophageal rupture. Okay, so the most likely cause of pneumomediastinum is esophageal rupture, and the other likely causes are rupture of the trachea, bronchi, or alveoli. So esophageal rupture is the most likely cause. Then rupture of the trachea, bronchi, alveoli. And the Boerhaave syndrome is the most likely cause of esophageal in the iatrogenic traumatic and neoplastic causes. So, pneumomediastinum is considered a medical emergency, and I would urgently convey the finding to the referring physician and discuss. Okay, so you need to know that you need first to discuss the medical history to exclude the iatrogenic cause of esophageal. Okay, then you need to recommend a water-soluble contrast swallow to confirm that the ruptured esophagus is the cause, to confirm that the esophagus is the source of leaking by water-soluble contrast swallow. And water-soluble contrast swallow is only done if the patient is stable, okay? Okay, then you need to recommend a CT scan. Why? To exclude the esophageal mass as the cause of the esophageal rupture. Esophageal mass creating a fistula as the cause of the leakage, okay? So, and you need to know that CT scan is done for unstable patients with pneumomediastinum, okay? So, you recommended a water-soluble contrast study, a water-soluble contrast swallow, and the patient is stable, so it is done. As you know, water-soluble contrast swallow is performed only for stable patients. Stable patients swallow. To remember this, swallow needs stable patient. Okay. How to remember this? A swallow needs a stable patient. Swallow needs a stable patient. Okay. Okay. So you recommended water soluble contrast swallow. Okay. Can you see water soluble? Okay. Not barium. Water soluble because there is suspicion of esophageal rupture, and you don't need the barium to be leaked into the mediastinum. Okay, so please don't water soluble. Okay, not barium. Why? For suspected esophageal rupture. Okay. So, what you expect to see on water-soluble contrast swallow? Leakage of the esophageal content. So, the patient swallowed and the water-soluble contrast is seen here, is passing here, and once it is passing through the area of esophageal leak, okay, it goes like this. Okay, so the contrast media is seen leaking into the mediastinum. There is a large amount of extraluminal. It's extraluminal now. It's not inside the lumen. Okay, extraluminal contrast in the mediastinum adjacent to the lower third of the esophagus. Leaking of contrast, or you can say extraluminal leakage of contrast, still adjacent to the lower third of the esophagus. What about the CT scan? In CT scan, you will see the leakage of fluid and the leakage of air and the fluid from the esophageal lumen at the CT scan. There are bilateral pleural effusion. The left is far larger than the right. There is also evidence of left-sided pneumothorax with an air fluid level denoting a hydropneumothorax with mass effect. This large amount of extraluminal air and fluid causing mass effect on the lungs, with almost near total collapse of the left lung, except for a small part of the left upper lobe. And also there is basal atelectasis on the right side, indicating collapsed lung here. Okay, there is air density within the mediastinum. There is also air density within the mediastinum and extending into the extending into the pericardial sac, as well as the soft tissue of the neck, as I mentioned, pneumomediastinum, indicating leakage of air, signifying pneumomediastinum and pneumopericardium, but no esophageal mass is noted The findings represent esophageal rupture causing air and fluid from the esophageal lumen to escape into the mediastinum and left pleural space. Principal diagnosis: Boerhaave syndrome, esophageal rupture caused by forceful vomiting. Differential diagnosis: other causes of esophageal rupture such as iatrogenic traumatic corrosive material ingestion. Management: urgently contact the referring physician and recommend urgent surgery referral, as this patient likely needs urgent endoscopic management of the rupture of the esophageal rupture, as well as insertion of a left chest drain for the management of the left hydropneumothorax. Okay.